Did you know that some medical tests recommended after age 75 could actually shorten your life instead of extending it? That's right. The very screenings doctors call routine might steal your independence, drain your energy, and fill your remaining years with unnecessary procedures and treatments. This isn't a conspiracy theory. This is medical science. Major healthcare organizations are now saying what many doctors have known for years. After 75, more testing often means more harm, not more health. Today, I'm going to reveal 4 tests that millions of seniors undergo every year, not knowing they have the right to refuse them. By the end of this video, you'll understand exactly why these tests deserve a serious conversation with your doctor, and why saying no might be the best health decision you ever make. Welcome to the Wisdom Vault. I'm so glad you're here with me today. After 75, our healthcare priorities should shift. Quality of life matters just as much as quantity of years. Yet many seniors are pushed into screenings that lead to anxiety, painful procedures, and treatments that reduce comfort without adding meaningful life. I want to be clear. This information empowers you to have better conversations with your doctor. Every person is unique. Your decisions should be made with a healthcare provider who knows your complete history. What I'm sharing today is based on current medical evidence from leading organizations, but it's not a substitute for personalized advice. Now, let's talk about these 4 tests and why experts believe they deserve reconsideration after age 75. Test 1. Routine colonoscopy. The first test to reconsider is routine colonoscopy. This is the screening for colorectal cancer. For decades, colonoscopy has been the gold standard for preventing colon cancer. It's truly valuable for people in their 40s, 50s, and 60s. But once you reach 75 and beyond, the picture changes dramatically. Here's why. Colorectal cancer is a slow-growing disease. It typically takes 10 to 15 years for a small polyp to develop into cancer. If you've had regular screenings throughout your life and they've been normal, the chances of developing dangerous colon cancer in your remaining years become quite low. Now, let's talk about the risks. The preparation alone can be quite difficult for older adults. You must follow a strict clear liquid diet, drink large amounts of laxative solution, and spend many hours in the bathroom. For someone with limited mobility or heart conditions, this can cause dehydration, electrolyte imbalances, and even dangerous falls. The procedure itself carries increasing risks with age. You're given sedation. A long flexible tube is inserted through your colon. Complications like colon perforation require emergency surgery. Anesthesia problems are more common if you have heart or lung conditions. If something is found, a polyp removal carries risks of bleeding. Larger abnormalities mean more procedures, biopsies, or surgery. The United States Preventive Services Task Force recommends against routine colorectal cancer screening for adults over 75 who have had adequate prior screening. They recognize that potential harms often outweigh benefits at this stage of life. Test 2. Mammography screening. The second test to reconsider is routine mammography. This is breast cancer screening for women. Mammograms have saved countless lives, especially for women in their 50s and 60s. But after 75, the benefits become much less clear, while the downsides actually increase. Here's what happens. Mammograms detect very small cancers, sometimes barely visible. In younger women, finding these early is crucial, but in women over 75 with other health conditions, these findings often lead to overdiagnosis and overtreatment. Overdiagnosis means finding cancers that grow so slowly they would never have caused problems during your natural lifetime. If a cancer takes 15 years to become dangerous and you're 78 with heart disease, that cancer won't affect your health. But once cancer is found, it's hard to just watch and wait. You'll undergo painful biopsies, surgery, possibly weeks of daily radiation, or years of hormone therapy. These treatments have real side effects. Surgery causes pain and limited arm movement. Radiation means 6 weeks of daily trips, skin burns, fatigue, and nausea. Hormone therapy causes hot flashes, joint pain, and mood changes. These affect your ability to care for yourself, enjoy hobbies, maintain independence, all to treat a cancer that might never have bothered you. The American College of Physicians suggests women over 75 with serious health conditions should discuss stopping routine mammography with their doctors. The focus shifts to maintaining comfort, dignity, and quality of life. Before we move on, I want to ask you a gentle question. Have you ever felt pressured to undergo a medical test that you weren't sure you needed? Or have you had a screening that led to more worry than benefit? Please share your thoughts in the comments below. And if this information is helping you, please like, share, and subscribe to the Wisdom Vault. Your support helps us continue creating content that empowers seniors to make informed health decisions. Also, make sure you watch this video till the end, because the remaining points are just as important and may protect your health. Test 3. PSA testing for prostate cancer. The third test to reconsider is PSA testing. This is prostate cancer screening for men. The PSA test is a simple blood test. It can be valuable in younger men, but after 75, it often causes more problems than it solves. Here's the fundamental issue. Prostate cancer is extremely common in older men, but most of these cancers are not dangerous. Studies show that over half of men who died from other causes in their 80s had prostate cancer they never knew about. Cancer that played no role in their death. When you get a PSA test after 75, there's a high chance of finding an elevated level. But this doesn't mean dangerous cancer. PSA can be elevated from normal aging, enlarged prostate, or even bicycle riding. Once that number is elevated, it triggers more testing. Next comes a prostate biopsy. Multiple needles inserted through your rectum to take tissue samples. This causes pain for days, bleeding for weeks, difficulty urinating, and serious infections requiring hospitalization. If cancer is found, then comes treatment decisions. Surgery or radiation can cause permanent side effects: urinary incontinence, erectile dysfunction, bowel problems, ongoing pain. These devastate a man's dignity and independence. Imagine losing bladder control, planning every outing around bathrooms, feeling embarrassed socially, and tragically, this often treats a cancer that would never have caused problems. The American Urological Association recommends against routine PSA screening for men over 70. The harms of screening and treatment far exceed any potential benefits. Test 4. Excessive bone density screening. The fourth test to reconsider is repeated bone density screening, also known as DEXA scans. An initial bone density test can be helpful for women over 65 and men over 70. But what often happens? The test gets repeated year after year, even when you're on stable treatment. Here's why this doesn't make sense. Bone density changes extremely slowly. Meaningful changes take at least 2 years to show up, often longer. Testing every year provides no useful new information. Once you're on medication and taking calcium and vitamin D, your fracture risk is being managed. Repeating the scan won't change your treatment plan. There's also psychological burden. Every test creates anxiety waiting for results. Medical guidelines suggest testing every 2 to 3 years for people on stable treatment is sufficient. The focus should shift to what actually matters: taking medications correctly, good nutrition, safe exercises, and most importantly, preventing falls. Fall prevention is more important than scan numbers. Remove tripping hazards, ensure good lighting, install grab bars, review medications that cause dizziness. These are more valuable than another DEXA scan. So there you have it. 4 commonly recommended tests that deserve a thoughtful conversation with your doctor after age 75. Routine colonoscopy, mammography, PSA testing, and excessive bone density screening. This information isn't about avoiding medical care. It's about being wise and informed. More testing isn't always better, especially when it can lead to procedures that reduce your comfort without truly extending your healthy years. Remember, you have the right to ask questions. You have the right to understand why a test is recommended, what the benefits and risks are, and what might happen from any findings. You have the right to consider your own values and what matters most to you at this stage of life. A good doctor will respect your wishes and work with you to create a care plan that honors both medical wisdom and your personal priorities. Bring this information to your next appointment. Ask questions. Share your concerns. Together, you can make decisions that truly serve your well-being. Thank you for watching. If this helped you, please like, share, and subscribe to the Wisdom Vault. Growing older is a privilege, and you deserve healthcare that respects your wisdom and protects your right to live comfortably and independently. Until next time, take good care of yourself.